Medication has the power to heal, but I've also seen the devastating consequences when medications are misused or misunderstood. Benzodiazepines like Xanax and Lorazepam are widely prescribed despite serious risks. They're often seen as a quick fix for anxiety or insomnia, but the truth is these drugs can have a powerful hold on both your brain and body. Today we'll explore why these drugs, while commonly used, can be dangerous, especially with long-term use. We'll look into the science behind their effects and uncover the potential risks that patients need to be aware of. It's time for an honest conversation about benzodiazepines, their place in modern medicine, and how to prioritize your health and well-being if you're prescribed these medications. Millions of Americans are prescribed benzodiazepines like Xanax, also known as alprazolam, and Lorazepam, often for anxiety and insomnia. These medications were never intended for long-term use. The FDA discourages extended use of benzodiazepines, yet many use them for months, even years. Long-term use increases the risk of dependence and withdrawal. The brain adapts, making it hard to function without the drug. If prescribed, don't panic. This information is to empower you. Have an open conversation with your doctor. Discuss your prescription duration, dosage, and alternatives. Here's the difficult truth. Long-term use of benzodiazepines has been linked to cognitive issues, including memory problems and cognitive impairment. Imagine struggling to remember simple things or experiencing brain fog. These are potential realities for some long-term users. Physical dependence is a real concern. Stopping abruptly can lead to severe withdrawal symptoms. Mixing benzodiazepines with opioids or alcohol can be fatal. Consult your doctor for a safe tapering plan. Let's face it, our healthcare system is often overburdened, leaving limited time for doctors to have in-depth conversations with their patients. This time crunch can lead to benzodiazepines being prescribed as a quick fix without patients fully understanding the potential risks involved. Adding to this challenge, some physicians may not have received adequate training in tapering strategies or alternative treatments for anxiety and insomnia. This is where you, the patient, play a crucial role. You have the right to be informed and to advocate for your health. Before starting any new prescription, especially a benzodiazepine, don't hesitate to ask your doctor about the potential risks, alternative treatment options, and the intended duration of use. Remember, knowledge is power. By asking questions and demanding clear information, you're giving informed consent and taking control of your health journey. Here's the good news. There are effective alternatives to benzodiazepines, therapies that address the root of the problem without the risk of dependence. One such approach is cognitive behavioral therapy for insomnia, or CBTI. This therapy focuses on changing the thoughts and behaviors that contribute to sleeplessness. Similarly, CBT for anxiety helps individuals identify and manage anxiety-provoking thoughts and feelings. These therapies are backed by scientific evidence and offer lasting relief without the risk of physical dependence. Beyond therapy, practices like mindfulness, regular exercise, and maintaining good sleep hygiene can be incredibly beneficial for some individuals. If you're struggling with sleep or anxiety, I encourage you to explore CBTI or anxiety therapy. You can find licensed providers through your doctor, mental health organizations, or even explore reputable apps that offer these services. Remember, there are many paths to healing, and seeking non-drug approaches first, especially if you're newly experiencing sleep or anxiety issues, is always a good place to start. For more in-depth information, consider reading The Path to Natural Healing, a comprehensive guide on non-drug therapies and holistic approaches to mental health. Awareness is key. Understanding the potential risks associated with benzodiazepines, advocating for your health, and exploring alternative treatment options are crucial steps in making informed decisions about your well-being. Remember, your health is your responsibility. Stay informed, ask questions, and don't hesitate to engage in open and honest conversations with your healthcare providers. You have the right to be an active participant in your healthcare journey. Together, we can create a healthcare system that prioritizes patient education, informed consent, and safer mental health treatment for all.